Important information. Indication and usage. INGREZZA valbenazine capsules and INGREZZA SPRINKLE valbenazine capsules are indicated in adults for the treatment of tardive dyskinesia and for the treatment of chorea associated with Huntington's disease. Important safety information. Depression and suicidality in patients with Huntington's disease. VMAT2 inhibitors, including INGREZZA and INGREZZA SPRINKLE, can increase the risk of depression and suicidal thoughts and behavior, suicidality, in patients with Huntington's disease. Balance the risks of depression and suicidality with the clinical need for treatment of chorea. Closely monitor patients for the emergence or worsening of depression, suicidal ideation, or unusual changes in behavior. Inform patients, their caregivers, and families of the risk of depression and suicidal ideation and behavior, and instruct them to report behaviors of concern promptly to the treating physician. Exercise caution when treating patients with a history of depression or prior suicide attempts or ideation, which are increased in frequency in patients with Huntington's disease. Please see additional important safety information at the end of this video.
Hi, my name is Pinkie Fitts, and I'm a psychiatric nurse practitioner at Montgomery Psychiatry and Associates, a private practice located in Montgomery, Alabama. I'm here today to talk about tardive dyskinesia, or TD, in patients who are receiving antipsychotic treatment and suggest a quick assessment of TD for your practice. Regular screening of all appropriate patients for TD is the first step in managing TD. As a nurse practitioner and one of the primary points of contact with my patients, I'm in a unique position to assess and identify TD movements. As we know, every patient taking an antipsychotic for a prolonged time could be at risk for TD, so it's important to regularly assess all patients taking antipsychotics. The APA has recommended monitoring for signs of TD every 3 to 6 months, especially in patients more than 50 years old. It may surprise you to know that for every 20 or so patients on antipsychotics I see, I usually identify 2 with TD, which is consistent with previous estimates. The office staff is also helpful in identifying patients with involuntary movements who require additional screening. I typically have a total of 15 minutes for each patient visit, and I spend the first 5 minutes beginning to look for TD while I'm covering basic information with the patient. The assessments are easy enough to conduct that I often do them in a telepsychiatry setting. I look for signs of TD as they walk toward the exam room. I have them sit in a chair without any armrests. I ask if there's anything I can do to help the patient feel more comfortable, since it's easier to unmask involuntary movements when they are relaxed. As the patient and I discuss their wellness, sleep regimen, and other basic information, I'm taking notes about any movements I observe. Is the patient clenching their hands? This may be to hide involuntary movements. Does the patient or their caregiver mention difficulties with tasks or daily routines, such as eating, swallowing, or brushing teeth? How does their mouth move as they speak and listen? Are there signs of TD? To get a clear view of TD movements in the face, mouth, and jaw, I ask the patient to remove any gum or candy. Then I ask the patient to stick out their tongue so I can identify movements that may have been masked. Based on these initial observations, I may ask the patient to perform a few activation techniques to uncover any other movements. I ask the patient to place their left hand on their knee and with their right hand touch each finger to their thumb. Then have them switch hands and do this again. Sometimes I will incorporate a distractor, such as asking the patient to count backward from 100 as they do this. Sometimes patients complain of having restless legs because they have heard about the condition from advertising. Patients don't always know what to call their involuntary leg movements. That's a sign for me to look for uncontrolled movements of the legs, as they could be TD. If I do suspect any lower limb movements, I ask them to remove their shoes and socks to get a clearer view of their feet and toes. To help uncover involuntary movements, I ask specific questions about how movements may be impacting their daily routine, such as, have others noticed? How are involuntary movements impacting the patient physically, socially, and emotionally? Are they making the patient uncomfortable or self-conscious? If so, how? Because any patient receiving antipsychotics for a prolonged time could have TD, it is important to include TD screening in your practice. And remember, while some patients will openly discuss their involuntary movements, others may be more reluctant to talk about them without encouragement and understanding. As you work TD screening into your everyday practice, you will discover that identifying involuntary movements can be easily incorporated into your routine.
Important information. Indication and usage. INGREZZA valbenazine capsules and INGREZZA sprinkle valbenazine capsules are indicated in adults for the treatment of tardive dyskinesia and for the treatment of chorea associated with Huntington's disease. Important safety information. Depression and suicidality in patients with Huntington's disease. VMAT2 inhibitors, including INGREZZA and INGREZZA sprinkle, can increase the risk of depression and suicidal thoughts and behavior, suicidality, in patients with Huntington's disease. Balance the risks of depression and suicidality with the clinical need for treatment of chorea. Closely monitor patients for the emergence or worsening of depression, suicidal ideation, or unusual changes in behavior. Inform patients, their caregivers, and families of the risk of depression and suicidal ideation and behavior, and instruct them to report behaviors of concern promptly to the treating physician. Exercise caution when treating patients with a history of depression or prior suicide attempts or ideation, which are increased in frequency in patients with Huntington's disease. Contraindications. INGREZZA and INGREZZA sprinkle are contraindicated in patients with a history of hypersensitivity to valbenazine or any components of INGREZZA or INGREZZA sprinkle. Warnings and precautions. Hypersensitivity reactions. Hypersensitivity reactions, including cases of angioedema involving the larynx, glottis, lips, and eyelids, have been reported in patients after taking the first or subsequent doses of INGREZZA. Angioedema associated with laryngeal edema can be fatal. If any of these reactions occur, discontinue INGREZZA or INGREZZA sprinkle. Somnolence and sedation. INGREZZA and INGREZZA sprinkle can cause somnolence and sedation. Patients should not perform activities requiring mental alertness, such as operating a motor vehicle or operating hazardous machinery, until they know how they will be affected by INGREZZA or INGREZZA sprinkle. QT prolongation. INGREZZA and INGREZZA sprinkle may prolong the QT interval, although the degree of QT prolongation is not clinically significant at concentrations expected with recommended dosing. INGREZZA and INGREZZA sprinkle should be avoided in patients with congenital long QT syndrome or with arrhythmias associated with a prolonged QT interval. For patients at increased risk of a prolonged QT interval, assess the QT interval before increasing the dosage. Neuroleptic malignant syndrome. A potentially fatal symptom complex referred to as neuroleptic malignant syndrome, NMS, has been reported in association with drugs that reduce dopaminergic transmission, including INGREZZA. The management of NMS should include immediate discontinuation of INGREZZA or INGREZZA sprinkle, intensive symptomatic treatment and medical monitoring, and treatment of any concomitant serious medical problems. If treatment with INGREZZA or INGREZZA sprinkle is needed after recovery from NMS, patients should be monitored for signs of recurrence. Parkinsonism. INGREZZA and INGREZZA sprinkle may cause Parkinsonism. Parkinsonism has also been observed with other VMAT2 inhibitors. Reduce the dose or discontinue INGREZZA or INGREZZA sprinkle treatment in patients who develop clinically significant Parkinson-like signs or symptoms. Adverse reactions. The most common adverse reaction in patients with tardive dyskinesia, greater than or equal to 5% and twice the rate of placebo, is somnolence. The most common adverse reactions in patients with chorea associated with Huntington's disease, greater than or equal to 5% and twice the rate of placebo, are somnolence, lethargy, sedation, urticaria, rash, and insomnia. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. Dosage forms and strengths. INGREZZA and INGREZZA SPRINKLE are available in 40 mg, 60 mg, and 80 mg capsules. Please see full prescribing information, including boxed warning, at INGREZZAHCP.com.